Welcome to our video series on living with an indwelling catheter. Today I'm going to be giving you 10 top tips on travelling with a balloon catheter. Many indwelling catheter users are concerned that once they have an indwelling catheter they won't be able to go on holiday or travel. But actually, if you follow the 10 top tips I'm going to give you today, travelling with an indwelling catheter can be straightforward and problem-free. So here's 10 top tips. Number 1. Pack the right products. Make sure that you bring enough products with you for 2 catheter changes. That's in case you need to have an emergency change while you're on holiday, or in case any of the products become contaminated. Make sure you bring everything you would have with you normally for a catheter change, such as a spare catheter, inflation syringe, deflation syringe, extra drainage bags, and gloves if you do your own catheter change. Number 2. Don't pack all of your catheter products in your hold luggage. Keep some in your cabin bag. That's in case your hold luggage gets lost or in case you need to access any of your continence products while you're actually on the journey. Also bring some extra hand sanitizer with you too in case there's none left in the aeroplane toilets. Number 3. Contact the airline before you travel. Ask them if there's any advice or guidelines that they have for travelling with an indwelling catheter on their airline. Number 4. Give plenty of time travelling through security. If you need to bring with you liquids of over 100 ml, always make sure you get a travel certificate from your doctor or from your nurse. If you're concerned about going through security and people seeing your leg bag or other drainage bag, ask for a private screening at the airport, and the security team should take you aside to a place that's private and discreet to have your screening. Number 5. Consider using a leg bag. If you normally use a catheter valve to empty your indwelling catheter, try using a leg bag when you fly. You can order a free sample from the LINC-Medical website or ask for one from your healthcare professional. By using a leg bag, it means that you are unlikely to need to empty your catheter during the flight. So you don't have to use the in-flight toilets, which aren't always particularly hygienic. You may want to try using a 750 ml leg bag, which has a larger capacity and will allow you to go longer between emptying the leg bag. Number 6. Empty your leg bag before the flight begins. Do it in the airport toilets so that you don't have to use the in-flight toilets. Number 7. Have adequate medical insurance. We never know what's going to happen to us when we go on holiday, so make sure that you have adequate holiday travel insurance when you go abroad, which will cover you if you need to have an emergency catheter change and you can't do it yourself, or if you have any complications that need medical attention. This is an absolute essential if you're travelling with a catheter. Number 8. Know the nearest hospitals in your destination. Before you travel, look at the nearest hospitals that were covered by your health insurance policy or your travel insurance policy before you go on holiday. Make a note of their phone numbers, make a note of their contact details, their location before you travel, so you've got that all ready in case you do need any emergency care. Number 9. Stay hydrated. Make sure that you drink enough. It's easy when you're abroad in the sun and enjoying a time away to forget the importance of staying hydrated and drinking enough fluids. If you don't drink enough fluids, this can lead to all manner of complications, including blockages and an increased risk of infection. So make sure when you're on holiday, you drink enough fluids. Number 10. Use the right catheter for you. Many catheter users report that things like blockages and infections really ruin their holiday. Well, if you choose the best products that are available for you, then this can help to reduce the risks of things like blockages happening while you're on holiday. For example, if you're a patient who is prone to blocking, why don't you try using a LINC open tip catheter? These catheters are designed with 3 drainage holes to ensure maximal drainage and to reduce the risk of blockages. I've spoken to one patient who's told me that she's able to go on holiday now without the worry of her catheter blocking because she's now using a LINC open tip catheter. Recently she went on a cruise and told me how happy she was that she was able to go and forget she had a catheter because she was using the LINC Open Tip. She had no blockages while she was on holiday. If you'd like more information about LINC products, you can find them on our website, linked in the description below. If you like this video, please like it, and if you want to know more and see more videos from LINC-Medical, please subscribe to our channel. Thanks for watching.